I'm Aaron Cariotti. I'm a physician and director of the Bioethics and American Democracy program at the Ethics and Public Policy Center. For 15 years, I was director of the medical ethics program and a professor at the School of Medicine, the University of California, Irvine.
My name's Alethea Wieland. I'm president and COO of Clinical Research Strategies. We're a boutique contract research organization and executive management consultancy, over 35 years providing services to biotech, medtech, and the pharmaceutical companies.
Hi, I'm Peter Blaney. I'm the CEO of Induran Ventures. It's a general partnership that's focused on the creation of biotech companies.
I'm Concetta Dudley. I'm an attorney and bioethicist and adjunct professor with Johns Hopkins University.
I'm Jennifer Lahl. I'm the president of the Center for Bioethics and Culture.
I'm Megan Murphy. I'm a writer and podcaster and the founder and editor of Feminist Current.
In sum, we're already well into the transhumanist era. But the story so far suggests that far from delivering utopia, what it mostly delivers is a commodification of the human body.
When somebody comes to you with an experimental treatment, it's brief. When has there been a doctor to explain from beginning to end exactly what this is, exactly what it's going to do, what it's going to do in 10 years? And if they can't answer those questions, you need to be aware of that. It's experimental for a reason. If you want to be a lab rat, go for it. I was. In my 35 years of just working in the industry, you always have the bad actors, you know, and then when you have the bad actors, these are sort of the companies like the transvaginal mesh debacle. Then you had the baby powder debacle. In Europe, you had the breast implant scandal. You had the metal on metal and ceramic on ceramic orthopedic products. And so what's behind the scenes in terms of bringing a brand new product to market and how the regulators actually look at the documentation to prove that something is safe and efficacious before it's put on the market?
In the U.S., Health and Human Services, HHS, is the umbrella agency that is charged with the promotion and protection of human health. Under the HHS, we have several agencies, one being the NIH, the National Institutes of Health. That is the research and funding arm of the HHS. HHS also includes the FDA, the Food and Drug Administration. That is the regulatory arm of the HHS. The FDA is charged with regulating and approving 5 different kinds of products: drugs, biologics, medical devices, combination products, as well as medical software. We then have the CDC, the Centers for Disease Control. That is the statistics, the identification of disease and medical needs as they fall under HHS. And then the Public Health Service, PHS. The PHS is more of a policy and enforcement arm of the HHS. So collectively, those come together to address many of the American medical needs.
The public health institutions in the United States that were set up to ensure safety and efficacy of new medical products, to give recommendations to the public that would enhance our health individually and collectively, have failed in that mission.
When you're on that much medication, you have no idea what's up or down. You don't know who you are. You don't know where you are. You don't know anything. So why not perform treatments on somebody that doesn't know where they are, doesn't know up or down, or is just gonna say yes because they don't know what else to say because they're so scared and so hopeless? What else are you supposed to say besides yes?
I find that many of the people who go into research, who go into the biotech world, if you ask many of them, why are we doing this? Why are you doing this? Many will say, I want to work on those things that are going to improve humanity.
They go in with the best of intentions. And that's particularly happening at the lab bench. The researchers that are spending their life, we call them lab rats. They're slaving to come up with better things, and they do it with the highest ideals. When it runs into trouble frequently is the commercialization phase. When it's turned into product, it's suddenly handled by other people with other agendas.
Because I don't think that most technologies consider ethics first. I think what can sell or profit is considered first, which, you know, fair enough. We live in a capitalist society. I don't expect these things to be produced or to exist for free without any profit. Why would anybody do it if there is no profit motive, really, realistically? But I think that we've entered into some very dangerous spaces in terms of new technologies that are being produced and what's being, you know, we're experimenting on human beings.
It's been 6 years, over 6 years, almost 7 years since I've gotten the 10,000 milligrams of ketamine pumped through my body, and I still cannot sleep right. It's been 11 years since I got sick and was put on those prescriptions, and those side effects have still not gone away. Everything, from my stomach, from the way I feel, from my bones aching, from my brain processing things, from things going numb, from now getting diagnosed with things that I shouldn't be being diagnosed with because of something that they said would help.
And if you dig into the sources of that failure, what you begin to see is several problems. One is what has been called industry capture, that the industry, in this case, the pharmaceutical or the biomedical industry, that our public health agencies like the FDA and the CDC were meant to regulate, have been able to exercise undue influence over those very agencies that were supposed to be regulating these industries. And rather than serving the common good of the American people as a whole, instead, we very often have seen these agencies acting in the interest of the very corporations and industries that they were supposed to regulate. So we see the FDA, for example, rubber stamping products that have very inadequate safety and efficacy testing.
This seemed to be really well understood in the 50s. People began to get more cautious about the use of technology, recognizing that they were getting a lot of unintended consequence and creating a lot of problems that are very difficult to solve. Today, there are no breaks. People come up with an idea and they rush to market with it, and the institutions behind it support it totally. When I was putting this together earlier at the beginning of my career, and I talked about setting up these companies and so on, one of the things that I was really very much in favor of was P2P, public to private partnerships. What I didn't realize was, while it may be fine in dire situations to create a temporary alliance between public institutions and private corporations, putting them together to work that way all the time, that's the fundamentals in fascism. Ongoing, close collaboration between major corporations and public institutions. That's what I was recommending we do. I was naive. I thought, like the researchers around me at the time, having good intentions, that we were going to make good things happen for humans. We were going to solve terrible problems. We created terrible problems because the major corporations and the investors behind them had very different agendas.
Yeah, for the average person, I would be concerned about conflict of interest in this space, especially the relationships behind closed doors, relationships at medical conferences. You know, the regulators are oftentimes going there, as well as the scientific community. And let's face it, under the NIH, there are royalties that are being kicked in back to the NIH scientists. There can be those conflicts of interest that regular Americans need to know about. They do exist.
We have a system today where politicians get elected to office and they have humble beginnings, humble wealth. They retire multi-millionaires.
This is not the behavior of a public institution that is worthy of our trust at this point without some very serious reforms to remove the conflicts of interest with industry and pharma that have so compromised a place like the FDA or the CDC. So that, for example, we know that a majority of the FDA's funding now comes from pharmaceutical companies. These companies can pay user fees to expedite the FDA approval process. And those user fees are now more than half of the FDA's working budget. So how can it meaningfully regulate an industry when it relies on that very industry to fund its operations, right? This is a clear financial conflict of interest.
That's such a big tangled mess. I mean, because I really do I am a capitalist, you know? I like free markets. You know, I like people to be able to start businesses and not be so shackled by regulations and regulatory oversight and taxes and all this burden. I love the entrepreneurial spirit of the United States and the small businessman. You know, you come to America and you can, you know, start your own business and, you know, in years, you know, be a wealthy person because you did it on your own. So I love that, you know, that rogue, you know, wild, wild west spirit. But yeah, who's the gatekeeper? You know, who's the sheriff? Who's keeping everybody clean and honest? And we all know that there's bad people in the world. There's bad actors that just don't really care what they're doing as long as they're making money.
It's all a business. It's not about health or safety anymore. It's not about the greater good. It is about control.
They are not building technology around the core foundation of risk. And risk is all-knowing, all-seeing of all the consequential things that could happen as a consequence of what you're building. So one of the things we do in life sciences and in biotech is always think about risks, risk management, risk benefit. I don't see a way that you can anticipate all the things that could go wrong with, you know, managing machines and man.
So we can't, you know, if we say no, if we say wait, if we say stop, if we say don't, you're a Luddite. You know, are you anti-technology? No, I'm not anti-technology. I'm pro-safety. I'm pro-ethics. I'm pro being cautious. And having all the facts, as much information as possible, and I don't see that in today's, you know, scientific endeavors. You know, it's just, you know, nobody's pumping the brakes, everybody's pressing the accelerator.
How I'm here, I have no idea. The abuse that I got from the doctors and from those drugs, I have no idea how I'm alive.
Medicine does all kinds of things because they can, you know? It's the whole, you know, we can do it, but should we do it?
But it's not enough to invent technologies to save lives. We need to manufacture advanced biotechnologies here in the United States. That's why today I signed an executive order that directs the federal government to ensure biotechnologies invented in the United States of America are made in the United States of America.
And why I know it's serious business is that our White House, our current presidential administration, is very supportive by issuing prime statements that this is where we're heading next. we're going to go into this gene editing and transformation of the human body. And when I see that these other kind of like PR campaigns or campaigns that show an infiltration of that same thought is permeating throughout the United States, throughout Canada, throughout the rest of the world, I really know we have a serious problem where we're no longer autonomous. We're no longer necessarily covered under the Constitution. I see our very rights disintegrating before our very eyes.
We have become so accustomed to this moral relativism that if it's legal, it's somehow moral. Most of us are not big fans of Congress, for example. I don't look to Congress to get my moral grounding. We all need to be more aware of that. Don't look to government to say it's moral or not. If it's legal, you might not do jail time for it, but if it's immoral, for those of us with a faith grounding, this has all the eternal ramifications that one can muster. There are prices to pay in this life, and if you believe in the next. And that's where we are. So we need to move away from moral relativism and move into a space where we do the things that we know in our heart of hearts are the right thing to do, are the moral thing to do. This is an exercise in deciding at this inflection point in society which path we're going to choose.
You know, in the olden days, it was medical ethics. Doctor knows best. You don't question your doctor. You go to your doctor. He tells you what to do, and you are supposed to follow his orders. You know, now it's by committee. You know, we now have bioethics, which is medical ethics by committee. And, you know, everybody's weighing in. And the problem is we don't all have the shared values. So while you might have a great committee of a lawyer on the committee and a hospital administrator and a nutritionist and the doctors and the nurses and the counselors are all part of that ethical consult, what happens when they don't have shared values? And so we see that all the time in debates around technology. You have these people that says progress for progress sake is good. Get out of the way. Don't stop. We need this. And then there's people that are like, well, no, because then I won't trust you. I'm not sure. You know, you don't really care, and we don't have a shared value. We don't have a common language. So while, yes, I think technology has made the world a better place, yes, it also comes at a cost. And how do we as a public live together in harmony, in our diversity, but live in harmony is trying to find a way where we can have shared values and shared language.
I think part of the explanation for everything that's going on around us, which seems like chaos to many people, there are two fundamental pillars that provide stability for any civilization. Two major pillars. The first one is religion, and the second one is tradition. And in the West, we've thrown both of those out the window. Once you do that, you're into a gigantic experiment with endless unintended consequence, and it's not working again. It's absolutely not working, but we've thrown out everything that would create stability. And the family has disintegrated part and parcel of getting rid of religion and getting rid of tradition.
I think anyone who buys into the ideology of science as savior, of science as salvific, of science as being able to fulfill the religious longings that human beings have always had for transcendence, for life eternal, for union with the divine or union with something higher. If people think that that can be accomplished through our own ingenuity, our own will, and our own tools of science and technology, they're fundamentally deluding themselves, they're deluding other people. They're not only promising more than they can deliver, because they will deliver something, and whatever they deliver will not just be something less than superhuman, it will be something subhuman. It will be something that's dehumanizing. And I think, without naming names, there's plenty of people within the transhumanist movement that are advancing precisely those kinds of goals and that are framing the transhumanist project in precisely that way as ultimately our salvation, as our way of overcoming the permanent limitations of human bodily existence in this world, our finitude, our mortality, our pain and suffering. Technology can do things to mitigate our pain and suffering, but they will never fully eradicate pain and suffering, which at the end of the day are spiritual problems as much as they are sort of medical or physical problems. So those human beings who believe that they have or that they can acquire godlike powers are the ones that scare me the most.
And I think that overdependence on technology, on big tech, is really dangerous. On big pharma, really dangerous. I think we should always be skeptical and ask questions and try to look very, very critically at these things in terms of impacts, risks, ethics, impacts on our health, impacts on our society. I don't think, we certainly shouldn't be trusting corporations or the governments to be making all these decisions on our behalf and telling us what's best and what will keep us safe and what's best for our health. I fear that it's like leading us to a virtual reality where we exist online and are plugged in and hooked on pills to keep us from thinking or questioning too much or for desiring true joy and connection. But I hope that doesn't happen.
I think what makes people human is our limitations. The fact that we don't live forever, the fact that we don't know everything, the fact that we're physically frail, learning to live with all of those shortcomings, those limitations, that's what a human being is. Someone who has no termination date, can lift a building, and so on, they're not going to be human. What they are going to be, I don't know, but it's certainly not human.
The thing that is, not just adds to, but is the richness of this world, lies in the humans that populate it.
They don't think so.
They don't care. And the question becomes, when are we going to develop ourselves enough to finally say enough is enough of those people? And those are the people that we need to be able to deal with. We simply outnumber them, and we need to become more aware. We simply cannot be dismissive of our place as human beings in this world and cede our authority and our autonomy to those who simply declare it for themselves, who did not earn it, who do not justify it, but who declare it for themselves. We owe them nothing.
If we're going to alter the human genome, augment it, it brings up for me immediately the question of progress. Have we made progress? Well, in a material sense, obviously we have. I probably wouldn't be alive today without some of the interventions that have happened from technology. But then the important issue is, what do you do with the power that you're getting with this technology? How much progress have we made as moral beings in the last 5,000 years? None. If you were to ask me, why is Christianity or Buddhism or any of the major religions, Islam, why do they have any relevance for us today? Because the moral issues that are talked about are absolutely relevant today precisely because we have not made any advance as moral creatures. And so now you want to give us, perhaps not omnipotence, but greatly extend our powers and capabilities physically and mentally. What do you think is going to happen when you have people who haven't really advanced morally in 3 million years. We're not ready for this technology, and we should not be doing it. I think if we do it, it's way beyond unintended consequences. I think it will be the end of us as a species.
Who would have guessed? That's why I think it's the biggest scam of all time. It is the biggest scam of all time, and we're living in it.